And then, of course, I got thrown the question, who should be doing this so I can take digs at Doug. It's Digs at Doug hour. So, so should we fuse the joint? Well, this is the landscape, and this is kind of what I wanted to say. What are we talking about? Is it a lateral transiliac? And if so, is it a geometric construct or is it a threaded cage? And posterior lateral, again, we know those uh, companies that do that. Is it that kind of screw, or is it a direct posterior, direct joint type of entry, either with bone or with a cage? And then, as I just showed, there's now cages where you can then put transfixation screws through. So this is sort of the whole landscape of SI joint. One of the best studies, and this is really a regurgitation of this for this, is that Wang put out this paper in 23, and it was 57 cohorts, so 2,800 patients. So this is really good, and looking at all the different approaches. And I know this is busy, but just kind of in your mind, understand that these are all the different papers, and this is just for the lateral transiliac, both the threaded and the geometrics. And basically, the green is your baseline VAS scores. So sitting up there in the eights and nines. And the blue is your post-ops. So you can see your variation lines there. And then the bottom of the thing kind of shows the summary of each blue and green level. So they're getting them better. If you look at posterior lateral transiliac and you look at the posterior interpositional, you see what the VAS scores are there. Now, if we look at ODI, again,